our beautiful baby girl Peanut, and I want to say a big thank you to each and every one of the staff members. We felt nothing short of at home from the second we entered the building to the very moment we were discharged. A special shout out to Madison, Sam, Monique, Sue, Sarah, Lizzie, Rhonda, Jennifer, and Emily. We love you all so much. And it's a job for us. So it's like, it seems like it's very routine. Like we do this every day, but then like to know that like when you read things like this, that you like really touched someone. How are you? Aww. Great. Annie forgets how tall she is.
Hi, goodness. Hi, girl. Look at her.
She's so cute. Hi, sweet girl.
I was seen today at 3 p.m. for an MRI of my lower back. Joanne greeted me and brought me back to the MRI waiting area. She was kind, caring, and helped me complete the paperwork. When I went into the MRI room, I was greeted by Lindsay. Even though I have had many procedures in the past, I was feeling a little anxious. Through her kindness, gentle, reassuring voice, I was completely relaxed.
Hi, that's good to see you. Oh, it's so good to see you. My ladies. Yeah. Hi, Joanne.
Gosh,
Nice to see you too.
Outside of the MRI.
Yeah.
I think it's great that people will go out of their way. Not everybody does that. So the people that do, you feel like they really need to make it known that how different it is at Middlesex.
I'm writing to formally commend the outstanding professionalism, dedication, and quality of care demonstrated by Dr. Shija Thomas and the entire staff of the Middlesex Health Marlborough Medical Center during a recent emergency medical event. Dr. Thomas exemplified the highest standards of emergency medicine. Equally deserving of recognition is the nursing and support staff at Marlborough Medical Center. Every interaction reflected teamwork, professionalism, and a shared commitment to patient-centered care. This is a great place, and there is a lot of heart here, and people actually care about you.
The before and after care, it was phenomenal. It was something to talk about. It was an experience that is gonna be with me forever.
Diane is a wonderful, wonderful patient.
Yeah.
We've gotten to know her quite well, actually.
Yeah.
Me and Joanne have scanned her a few times. I've come to learn her life really well, actually, as a patient and a friend. So I look forward every time I see her name on the list, and we catch up every time, which is nice. It's more than just patient care at that point. It's actually becoming friends with our patients.
I will tell you that I was terrified, and I was admitted about 7:30 on a Tuesday night, and by 9 o'clock, Natalie, my nurse, asked me how I felt. And I said, to be honest with you, I feel completely at peace, because I know everything was beyond my control, and everybody who was there and responsible for my care knew what they were doing and was absolutely committed and concerned. That's extraordinary.
A love letter. From about 7:30 on the evening of Tuesday, January 20th, until afternoon of Friday, January 23rd of this year, I was a patient in the critical care unit of Middlesex Health.
All things being equal, I wouldn't have chosen to be here the night of the 20th. I wouldn't have chosen to be in a hospital bed. I wouldn't have chosen to have 3 IVs running at the same time. But then Natalie, my night shift nurse, asked me how I felt that first night. I said, completely at peace, and I did. Then there was Shannon, my nurse on day shift Wednesday and Thursday. Brilliant, funny, competent, forthright, caring. Each of them made it impossible for me to be anxious. All of them made it me positive. I was in genuinely caring hands.
All of the rest of us get the luxury of caring about people on occasion when we're up for it. They have to do it all day, 12 hours a day when they're here, and I don't know how they do it.
It's so nice to see that people still appreciate why I originally went into nursing. people like this is who you advocate for. These are the people that you fight your hardest for because they put total faith into you.
I'll tell you, I've been a nurse 25 years this June, and I've worked at many different hospitals. And this hospital is the best hospital I've ever worked at. It's like you walk by people and they say hello. And I think that we treat strangers and family members the same way. And I think that's why they feel so, welcomed.
And she really encourages me. She brought out something inside of me that I didn't know that it was there. She was there for me. She took personal time from her personal life to make sure that we were okay.
We just want to save life. Just make sure that it's the end goal.
They say do no harm. I've extended that through my career to do no harm and reduce suffering. And I get to do that here because I have time. So I'm like a 5-foot hug, I don't save lives every day, but I try to make people feel better.